So there's a variety of things that the community can do. I think this piece of research is about an effort called the Pediatric Epilepsy Learning Healthcare System. The vision of that organization is that all children with epilepsy receive timely and optimal care according to standards that are continually improved. And so what we've been doing is we've been collecting electronic health record data from these 11 centers, and we have aims to increase to 20 and more. And what makes us a learning healthcare system is that we'll collect the data, look at our results, go back and change our practice, and then do it again and again and again in these virtuous cycles to try to get ourselves as close to perfect as possible. What's nice about this system is that if the recommendations change, if we learn, for example, that one of the latest kinds of data is that maybe we should be using 2 therapies instead of 1 for infantile spasms, if the data really bears that out, that we can monitor that in semi-real time and then try to change as a community so that all of our centers are giving the best possible care. And then, paired with that, I think we need to continue to work with our professional organizations and our advocacy groups to get the word out through educational symposia to make sure that that there's good understanding throughout the entire community about what first-line therapy is. A quality measure is meant to be a tool to help with quality improvement. It gives a numerator and a denominator and lets you measure something and to see where you are. And then if you're unhappy with where you are, you can improve. Part of, so our goal with the Pediatric Epilepsy Learning Health System is multiple. We want to measure it, so we've done that. 90% is now our benchmark. We want to improve it. We're going to see if we can get to 95%. And then we want to, help other centers understand where their benchmarks should be and to give them strategies to improve as well. I don't know if 100% is the right number. There are some children where you can make a good argument that our first-line therapies are not appropriate for that child. And we don't want to go into a physician's business and question their judgment. The interaction between a physician and patient is sacred, and we really want to protect that. And there are conversations that are happening in that room that we're not privy to, and there, so we don't know if 100% is going to be what we are going to get to, nor if that's where we should get to. But the purpose of the quality measure is to look for leakage, to understand where children aren't getting recommended care, where centers would like to do better, and then to help them to do that. I should mention that in the world of epilepsy, there are 2 epilepsy learning health systems. There's ours, the Pediatric Epilepsy Learning Healthcare System, which is focused on children. It's largely pediatric epilepsy doctors that are working on it, but there's also a parallel and aligned all ages epilepsy learning healthcare system run out of the Epilepsy Foundation. Brandy Fuhrman and Sue Herman run that. We work quite closely with them to coordinate our efforts. I think our goals are quite aligned to improve care for everyone with epilepsy.